Here's an important question for you. Are you at risk of diabetes? Michael Hennessy from Diathrive is joining me now. This is something you definitely know about. Let's start with how big of a problem diabetes is in our country, Michael.
Yeah, it's a surprisingly big problem. So right now there's about 30 million people in the United States that have been diagnosed with diabetes, but some studies actually say that within 20 years, half of the country will either have diabetes or be pre-diabetic.
What are the risk factors that people need to know about that can lead to diabetes?
Yeah, so there are two types of diabetes. For type 1 diabetes, it's an autoimmune disease, and it tends to run in families. So if one of your relatives has had type 1, that's kind of the correlation there.
There's a genetic component with that one.
Exactly. And then for type 2, really less is known about it, but it also runs in families. But some indicators of it are like if you've had gestational diabetes, for example, when you've been pregnant. And then the only real causal factor that they've identified is weight. So obesity is an indicator of diabetes.
Michael, how do you know when it's time to see a doctor?
Good question. And this is a really tough question too, because a lot of the symptoms are pretty subtle. But things like having to go to the bathroom more frequently, feeling very thirsty, feeling hungry even though you're eating normally, blurry vision, extreme fatigue, things like that are the causal factors, the kind of indicators.
Maybe you're experiencing some of those. How do you know then when you get to the doctor? Did they know how to diagnose you? What questions do you ask?
Yeah, that's great. And a lot of doctors aren't trained, primary care doctors might not be trained specifically in diabetes. So the most important thing is to get a blood test. And your normal fasting blood sugar should be between 70 and 130. And so if your doctor has concerns about it, should ask you to fast before you go to the blood test.
Are there kits at home that you can test for diabetes or pre-diabetes and not go to the doctor first?
Yeah, there are. So with just a little machine like this, you can test right in the privacy of your own home.
That's
and
so
a
tiny.
lot of insurances aren't paying for it now if you're not diagnosed with diabetes. So it's a good thing to do right.
So that might be the first step, Michael?
Yeah. It can be for people.
Little like that. For more information, if people want to know about this, what should they do?
So go to www.diathrive.com or call us at 866-878-7477 and we can get you started.
Michael Hennessy joining me today. Valuable information. Thank you, Michael.
Thanks, Nisha.